Hi guys, it's Dave. Today we're going to talk about SAD, SAD, or Seasonal Affective Disorder. What is it? It basically is a depression that you develop during a particular time of the year. For the majority of cases, it happens in the fall and the winter. A few times it'll happen in spring or summer, but generally not as much because one of the main things that you see with SAD is the effects of a lack of sunshine and a lack of activity. So people are more prone to have it occur during the colder times of the year. It's not just the winter blues, it's not the holiday doldrums where you're trying to make everybody happy, you're stressed about getting things done before Christmas, New Year's, Hanukkah, trying to get everything fit into that little bit of time. The kids are out, you're dealing with that. No, this is something that starts in the fall, runs through the winter, and then again in the spring, you'll get back to your normal self. It is different than regular depression, like I said, because it just occurs during a certain time of the year. They believe that it's actually related to circadian rhythms in the body. So people may experience this also with shift work. If you're a shift worker that goes from days to nights, you may find out that you're experiencing it because during the day you're sleeping instead of being out and about. However, with the SAD, it is timeline based, so it's during certain time of the year. So what can you do about it? Number one, take it seriously. If you're feeling down in the dumps, the blues, a little depressed for maybe 1 or 2 weeks, that's not necessarily what's going on. It's for a longer period of time. And if you see it develop over several years, where this happened last year, now it's happening this year, now it's happening, that kind of situation, you can kind of understand that you may actually have SAD. In other countries of the world, they actually do a lot of supplementation with vitamin D, as in dog. Because, like in the northern countries, in Estonia, in that area, they will do that because the lack of sunshine not only occurs because people are going to be inside because of the weather, but the amount of sunshine during the day goes down as well. So instead of a normal maybe 9 to 10 hours, they're getting about 5 to 6 hours. So one thing that you can do is vitamin D supplementation. I recommend generally getting about 2,000 units a day in with that. The other thing that is also important to do is, even if it's cold outside, try and get outside. Have some activity, do some physical exercises, just get out in the sunlight where you can boost your vitamin D naturally and elevate your mood. There are some medications that you can try. If you feel like you have that, definitely talk to your provider or doctor about it. Antidepressants such as sertraline or Zoloft, fluoxetine or Prozac, or bupropion or Wellbutrin are generally used. There are some other options as well. Something else that you can do is light therapy, which is a device basically that you will have that will provide fake sunlight to you. It's not a tanning bed. I'm not condoning that because obviously skin cancer risk. However, the light therapy can be effective. It can be a little awkward as well. The other thing is, don't be afraid to talk to somebody. There are many good counselors or psychologists that you could go to actually be able to verbalize and get those feelings out. In combination with some of the other tips that I mentioned, there are ways to deal with SAD to give you a more normal winter, fall time of year to help beat those depressive times that you're going through.